The other three candidates that we have here are Teresa Collett, clap, Joe Blum, and Brad Lee.
The reason I got into this campaign is because of jobs. The simple fact is that my law students can't find jobs. Now, a number of you think that's a good thing when lawyers can't find jobs. And I understand that, but it's not just my law students. It's my son-in-law who's graduating from the University of Minnesota with his engineering degree. It's my friends who are carpenters. It's my friends who are nurses and teachers. It's throughout the economy.
I'm Joe Blum, and I'm running for Congress because I'm 29 years old and I haven't been represented in those 29 years in the United States House of Congress. Now, I'm running because I went to a town hall meeting this summer with our current representative, and she was there, and she took questions, but every time a person came up with a conservative question, she would just pause and go next.
My name is Brad Lee, and I've been in business for 35 years. The reason why I got into this race was simple. I've gone through a lot of experiences in my life, from when I started out with the Navy to when I opened my own small business about 4 or 5 years ago. What I won't stand for is our government coming after my children, my grandchildren, their paychecks, and our liberty. We need to stop that.
Then that's where my experience as a constitutional litigator kicks in. Because they've been talking about not only using reconciliation, but using the idea that the Senate bill will have been deemed to have been presented, and that's why the House can vote on it, even though it's not been written, it's not been presented to the House. It's crystal clear from Article 1, Section 7 of the Constitution, that the presentment clause is violated by that.
You know, those frivolous lawsuits, those got to be reformed. Otherwise, that's what drives up the premiums in insurance. Insurance reform is what we need. We need to deregulate the insurance, allow it to be sold across state lines. We need to allow there to be competitive insurance rates. Like Minnesota here, we don't allow a for-profit insurance company to sell insurance in our state. How ridiculous is that?
We all can agree this bill that they currently have needs to be killed. We don't need it. We don't need a government takeover of health care. For example, Social Security. Does anybody have any idea how long it takes to get a disability claim through Social Security on average? 444 days. That's what's going to happen to our health care system if they are allowed to take it over.
What role do you think government has in responding to those problems? Because this is a question that, of course, Democrats throw at Republicans all the time.
Do you want us to keep the same order? Or do you
Well,
want to
why don't
shift
we?
one?
We'll start with Brad. We'll go this way.
Okay.
The things we can control on pooling our resources, it's a matter of risk. If you spread the risk around, more people are covered. We all pay a little portion for that risk. We can insure ourselves for, cut fingers, broken legs, kids get into trouble for. We can handle that. It won't necessarily break the budget if we have jobs and we're working. It's really the catastrophic things, or pooling huge groups of people together if you lose your job. That's one thing. One area where government can support that system is to prevent us from getting gouged by unnecessary costs and restrictions. And they can prevent monopolies. Right now, they're setting up monopolies. I think government should come in, break it up, and eliminate monopolies and get competition back in the marketplace. That's what's going to drive costs down. Collectively, if we have large pools of people, it will spread the risk out for everybody, and it will make all of us more insured. We should not have any situation where somebody loses coverage because of some devastating illness. That's not Christian, that's not Republican, that's not even American. We can work together to fix this. We just can't let government take it over and fix it. We can do it ourselves.
It's quite hard to follow that because Brad pretty much laid it out the way it needs to happen. But like you said, government is not the be-all, cure-all of everything. And With insurance, as with everything else, it doesn't behoove us to have somebody else support someone who's in need. Yes, as a Christian, yes, as an individual, we have an obligation ourselves to do it, but none of us can say, okay, you over there, you should pay money into the insurance pool because so-and-so is uninsurable. None of us has that right. That was never in the Bible. Jesus never said to Caesar, these people are poor, take care of them. He said to each and every one of us, love your neighbor. He didn't say, Caesar, government, love your neighbor. But like Brad said, what we need to do is we need to open up the market. Have that pooled risk, but have it across the different insurance companies and the monopolies. And the fact that government's trying to create their own monopoly with the public option. And this healthcare bill just needs to fail. We need to have real solutions, and I'm glad and proud that Brad has a really good plan because it's the same plan as I offer. It's really a great plan because that's how you win. You open up the insurance policies and everybody wins. The free market decides, and the pooled risk, if you put the high-risk person with a lot of people that are low-risk people, if you put the overweight people with the people that are very fit and athletic, you win because, unfortunately, it spreads out the risk a little bit, but it's done by a private insurance company. It's not done by the public, the government. Thank you.
Well, frankly, I don't think either candidate before me has answered the question that David asked. He's talking about high-risk pools. The state of South Dakota has one of the most successful high-risk pools in the country. This is an area I know a little something about from my bioethics. And the problem is when you have a child born with certain disabilities, they are a high-risk child. And unless you mandate coverage, unless you mandate these private insurance companies, including them, you can't spread the risk. How do we take care of those people who have not been insured, who suffer from a high-cost condition? And the fact is that is the limited place where government necessarily must be a part of it. Unless, of course, we're going to mandate inclusion of everyone who applies, which is one step closer to the public option. That's how government regulation came into this area. So there is a small role for government in this area. I agree with both Brad and with Joe that the average insurance policy should operate in a way, but part of it is that in creating that, you've got to incentivize, not mandate. One of the problems with the current health care bill is the health care mandate. I think it's unconstitutional. But we can incentivize. Right now, there are special tax breaks for health insurance. Everybody needs those tax breaks, and in certain circumstances where you have high-risk people, you can incentivize the private market to serve that. So if you incentivize the creation of special insurance companies that specialize in this, you can minimize government involvement without intruding on the basic principle that this is something that private industry can take care of.
Shockingly enough, our next question has to do with jobs and the economy.